Imagine the anxiety patients face when diagnosed with a serious medical condition. Medical care professionals will attest a positive mindset enhances the effectiveness of treatment and recovery.
I don't think you realize the difference that is made when we can help people with basic life needs and supportive and integrative therapies to help with mental well-being and health and wellness during this crisis in their lives.
I tell patients this all the time. Having a positive attitude, keeping that hope alive with any sort of diagnosis is extremely important in their well-being, and patients who keep that positivity usually have a better outcome with treatment.
That holistic approach is where the Barnes Jewish St. Peter's and Progress West Foundation plays an integral role in providing services that enhance medical care.
The pillars of the foundation are health, healing, and hope. And today, we're supporting those in a variety of ways across our hospitals and for our patients, for our caregivers, for their families, for our entire community.
Foundation employee Teresa Daly discovered one day she would transition from provider to patient with firsthand appreciation of the foundation's services.
So in 2022, I knew I was having some health issues, and I had tried going to my primary care doctor and having some tests run. I knew things weren't quite right. They were able to do an MRI on me at Progress West and find the tumor in my pancreas and surrounding areas. So did chemotherapy for 180 days. You know, chemo is hard, and I like to play tough. There were times when I would sit right here in this living room and I did not think I was gonna make it. And my husband would look at me and he would say, "Yes, you are, you're a Supergirl." And that's what got me through it.
The foundation definitely helped my mom through a lot because my dad works 48 hours at a time, and he can't take off every single day.
Having now been through it and received some of those services, you know, it gives you a broader appreciation for them. It puts the why behind the fundraising effort. Everyone knows we raise money for services, but what are those services?
Transportation. A lot of patients, if they don't have the ability or family members that can drive them.
It's the Insure program. Basically, if somebody is struggling with eating for a lot of reasons, you wouldn't think some Insure would actually would mean all that much, but for people that are going through a really difficult time, those little things mean the world to them.
Even the horticulture is something. When you think of health, healing, and hope, you don't think about the botanical gardens and someone coming in and having plants that relax you or that are anti-nausea remedies.
Yoga, the massage therapy, all of that is like an added bonus that they experience whenever they're going through cancer treatments.
One of the things the foundation helps with are screenings and promoting blood drives and just different proponents of being proactive in our day-to-day life.
Another foundation-supported program is pet therapy, where a heartwarming visit from service dogs brightens the day for patients, their families, and hospital nurses.
A lot of these things patients and families don't get to see. Nurses, we are trained to be caregivers, and we do that, but it comes with a lot of stress. Sometimes we really stop to care for the caregivers, healing the healers, to heal the healers, to support our team that are providing care and services to our patients.
Caretakers are also going through a lot, so I think it's almost like a relief that there's opportunities out there for them that they are cared for too. They're caring for somebody else, but also they are cared for through the foundation and the things that they provide.
Patient support continues even after patients return home. And the foundation is there to offer aid with insurance, prescriptions, and social workers.
The foundation gives us an opportunity to offer more support to our patients when they're ready to leave the door, so they have a good solid plan on I'm taken care of now, what are my next steps?
The foundation is doing so many great things currently for our patients and our caregivers. But we need to keep pace with the rate that our community is growing, and we need support in order to do that.
So I would encourage people, think about the future and think about if a member of your family might need this someday.
Thank you so much for the hard work that you're doing and the incredible opportunities that you're giving to our patients.
Thank you so much for your support, and thank you for helping us save lives.
I just want to say thank you. Thank you for joining us on this journey, and thank you for growing with us.
I personally want to say thank you because I received some of those services, and I know how important they are when you're going through this journey.